Have you noticed it takes a little longer to schedule an appointment with your primary care physician right now? Or maybe once you're at that appointment, you feel rushed through it?
Dr. John Rodriguez says it's a problem nationwide, but it's impacting every community, especially smaller ones.
I see a lot of my friends, primary care friends, have called it quits, and they've either left the scene already, or they're joining the big groups, or they've left healthcare and working for insurance companies.
But why are primary care physicians leaving? Dr. John Rodriguez is a chief medical officer of a direct primary care office. Essentially, it's a practice that has either a membership fee or takes direct payment from the patient, cutting out the need for an insurance company. While it's not an affordable option for everyone, Dr. Rodriguez says it does afford a more intimate relationship with patients and cuts down on overwhelming paperwork, which have become two reasons for doctor burnout.
And so your visit appointments now are down to 7 minutes on average, right? I mean, that's fine if it's a head cold, but if you're dealing with 3 or 4 medical problems like diabetes, high blood pressure, and heart disease, that's impossible to keep up with that in proper form.
Is there a concern for you for, a misdiagnosis or something that's missed in the appointment because it's sort of...
Absolutely. And I've seen it. Sometimes I'm a second opinion doc, so I'll see patients from other offices, and as well intended as they were, and their diagnoses were off. And we come up with a different diagnosis. And I see it. They were in a hurry. They were in a hurry to get the patient on. The patient had a few complaints. They didn't think they were important, but they were.
The Association of American Medical Colleges projects that in 2034, the U.S. will have shortages of between nearly 18,000 and 48,000 primary care physicians. That's in just the next decade.
I would bet that most of your listeners have probably experienced that already.
It's not a new issue. About 5 years ago, we met Dr. Bill Med, who worked well beyond his retirement years in the town of Norway because he couldn't find a replacement.
Do you worry about what will happen to them when you leave?
Oh yeah, I think that's probably the main thing that's continuing me working.
But there are changes being made. Dr. Med started working with Maine Health on a program to recruit more doctors to rural parts of the state. The question remains whether those changes are happening quickly enough.
But it's going to get worse. And the really issue is, you need the quarterback, right? You need someone who knows the healthcare system and how to maneuver through that. And if you don't have that, it's chaos.
So some advice: if you're losing your primary care physician, it's worth asking the practice or the physician themselves if they'd refer you to someone else. We've also shared a link on our website with a list of direct primary care physicians in Maine, if that is something you're interested in.